Thank you very much for joining us today. My name is Jackie Curry and I work in the development team at Cumbria Community Foundation. We've put together this short presentation to highlight the impact of the COVID-19 pandemic on Cumbria and how you and your clients can be involved in the response and recovery going forward. To begin today's session, Andy Beeforth, our Chief Executive Officer, will explain the Foundation's response to the implications of COVID-19 for vulnerable people here in Cumbria. He will outline what the needs are in the county and what the Foundation is doing to try to address those needs. We are very pleased to welcome today Rachel Holliday from West Cumbria-based charity Time to Change, who run Calderwood House, a homeless shelter in Egremont, and Women Out West, which runs projects to improve the lives of vulnerable women in the area. A very busy and inspiring lady, Rachel will speak about her first-hand experience of the impact of COVID-19 on charities working here in Cumbria. This is a coffee break length presentation. Should you have any questions regarding any of the issues raised, we're all working from home and happy to hear from you, and our contact details will be on screen at the end of the presentation. I shall, without further ado, pass you on to Andy Beeforth, and thank you for your time.
Thank you, Jackie. And I think Susan will now just move us on to some slides. And if we just go straight on to the next one, please, Susan, because I do want to just make this quick, but I know both you as advisors in the county and your clients are very interested to know what's happening through this absolutely exceptional time, what it means for them in their day-to-day lives, how the community's responded, but also for those who have philanthropic interests, want to support local charities or who are involved in them, it's important to know. And this slide is taken from our 2017 Cumbria Revealed report, which just sets out the statistics about underlying need in the county. And some of the key things are a large elderly population, but also some quite high levels of deprivation before the pandemic hit. So if we can move on, please. And then this is just what COVID has meant in Cumbria versus some England statistics, because we know this has been a worldwide and a national pandemic, but how has it affected Cumbria? And very sadly, we've had a higher number of cases, we've had a higher number of deaths, and looking at initial universal credit claim figures, particularly in the heart of the Lake District, but even across the whole county, because of the impact on tourism and other aspects of our economy, significant increase in universal claim credits. And the final one there is just what a large elderly population we have, which in part explains the death rates, but also we continue to have many people at home staying away from each other just to stay safe. So if we can move on, please, Susan. So just after the pandemic broke, all of our investment is in community organisations responding to the need. And we wanted to just know what was life like for them and how were they being affected. We know many had to close venues, had to repurpose their services, many couldn't fundraise, many with charity shops have had no income. And the really telling number on here is 59% of the respondents had 6 months or less in terms of reserves in the bank. And this is really important, particularly for those of you with clients who are either committing regularly to charities or who've got commitments in their wills, because very sadly, we imagine that some charities may go under. So if we can move on. So it's been an amazing response. We've raised just under £1.5 million so far. The largest has been from individuals and community group fundraising. We've had some very, very generous, significant philanthropic donations from individuals, but also we've benefited from a partnership with the National Emergencies Trust, which to date has distributed about £60 million across the country through community foundations. So again, if we move on. So this is really the important slide. How have we spent the money? Where's it gone? And at this phase, in terms of the response, the significant proportion is on supporting people in their own homes and just delivering food and medicine. And some of that food is not just in terms of food banks, but we've had an absolute explosion in new organisations and organisations we didn't even have a name for, which are now calling food pantries. But we've also built on local emergency response groups that were set up after the floods, which have stayed active in their communities, preparing for future incidents, and they've really come into their own. But if you scan across this slide, there's virtually no area where we haven't helped people, whether it be around mental health, youth, other support for older people. I was just talking about a group earlier on today supporting parents with children with learning difficulties, and just how hard it's been for them, and they've received support as well. So can we move on? That's the spread across the county. We haven't got much time. The only thing to say is, it's even apart from South Lakeland, where we've got a large elderly population, and actually one of our donors, about £300,000 of the money we've spent so far has been donor directed from a donor with a specific interest in both hospices and the elderly. And because of 2 hospices down in that part of the world, that's why that bar's a bit higher. And then moving on, because I don't want to take up too much of a coffee break, what does the future look like? Well, going back to that first slide, it's overlaying the existing need, new hardship on top of that. The need to support young people, many who may face a lack of jobs, many who've not had a good access to schooling or any access to schooling, people continuing to want to stay protected at home, and a big, big burden, the pressure on people in terms of their mental health. So you can scan down that. That's all for me for now. Thank you very much.
Rachel, if you'd like to tell us what's been happening with you.
Yeah, absolutely. So COVID hit, and instantly within the homeless hostel that we run, we lost 3 dedicated members of staff who all had to go home and shield. So overnight, we just had this big gap where we needed to man the hostel. Luckily, the staff just stepped up and just took overtime and overtime and overtime and kept it going. But when this lockdown came, I thought, how are we going to keep 10 vulnerable people in those rooms? So we got in touch with Brooks in town, and very kindly they come out and got big TVs into all the different rooms. We had elderly men in there with chest problems, so we were terrified of them getting ill. It was a really scary time. You know, there was no PPE for love nor money at the time. It was just everything had gone. Luckily, a couple of local organisations managed to get us some, which was brilliant. We decided with the Women Out West Centre to close the actual centre and move it online. And because we're a relatively new organisation, that happened quite easily. So we diverted the reception number to the receptionist's house. We had our project worker make a list of the most vulnerable women, and we got round and made sure all those women were okay and got what they needed to have. So I personally went out delivering prescriptions, food parcels, but one thing that did come up was the lack of internet in some of these ladies' houses, and some of them had children and they just didn't have access to internet, so we got dongles sent out. We were also made some women fleeing domestic violence and moving into new property with nothing, no white goods. So we managed to get some money from Sellafield and help women get cookers and fridges and that sort of thing, all online, all during this. When I said about the staff issue we had at Calderwood House, I didn't know how long my staff were going to be able to just keep up this level of work that they were doing. So we asked the Community Foundation for some emergency funds to hire temporary COVID workers, and that came through really quickly, which meant that we could train up some new people and get them into the hostel as quickly as we can. So that's gone ahead, and that's been really useful. And we didn't want to furlough anybody. We felt like if we furloughed our staff, we'd be pushing them into poverty, and that's not what we're about. So we made sure that they had things to do at home. The full-time worker who was at home, she was in charge of going through all 200 of our ex-residents and identifying the most vulnerable and if they needed any help. And then she would feed back to me for people who did need help. We've got some really elderly gentlemen that live by themselves and that sort of thing. So we took out food parcels to them and picked up prescriptions for them. I felt initially, after the shock, quite angry about the situation in homelessness, because I've worked in homelessness for 15 years and I've been homeless in the 90s, and I never seen a way that we could just take all these homeless people across the country and get them off the streets within 2 weeks. And I just thought it was possible after all, you know, and it just made me feel quite upset that there is an answer to this. We don't have to go back to the way of seeing the streets littered in Manchester, London, Leeds. and all the sofa surface that we have around in our area, that doesn't have to happen. We can do things differently. So one nice thing that occurred, Homeless Link got in touch and said we'd like to do some support for the CEOs around the country, and pulled about 8 to 12 of us together to share our experiences. And I just thought, isn't it sad that it takes a pandemic to get this level of interaction from other experience and really learning from each other? And so that's something that come out of it that was, for me, was really, really good. So yeah, I said about the staff being in poverty, and we didn't want that, so we didn't furlough anyone. And what we decided to do, quite the opposite of everyone else, we decided to give our staff a pay rise, and we moved to the £10 an hour mark. We were able to do this because we have built up some really good steady funds in the bank, and the reserves. And although sometimes funders might look down on us for having good reserves, I'm really proud that we were in a position that we had enough to just see us through this position, not furlough anyone, take care of everybody, and still be financially okay by the end of it. So yeah, that's a point of interest, I think, when people say, well, if you've got 3 months of reserves or less, we can't help you. Well, I'm just glad that we really did. We're in much better position to see everything through. So yeah, a couple of nice things that kind of happened. I remembered a food pass was taken up for a lady of domestic violence. And what happened with her was, because of where she lived and she had 2 young children, she kept having to use the corner shop, and she just used all the money up time and time again. So she was stuck. Normally she would go to do the big shop in town and save herself some money and make it spread, but she couldn't do that. So we took up a couple of bags of shopping, and I just remember the little boy coming out, and he looked in the bag. He said, "Is that apples?" He goes to his brother, "We've got apples. And I thought, oh my God, apples. I just never would have thought that as a luxury. I would always think chocolate and pop maybe, but not apples. And that really got to me. So yeah, it was a lovely, lovely moment to be able to deliver that. And that just brings me on to where we are today. Calderwood House still operational, still moving people through. My staff have been absolute heroes up there. The emergency response guys that we've hired, that's going really well. Thank you, Community Foundation, for that one. And Women Out West, we're moving towards opening back up again, but in a very small way, because we can only have one at a time in. That'll change, no doubt, over the next few months. But we've certainly been seeing ladies online, over the phone, getting internet into the houses. We've done, very quickly, we sent out, what we decided to do was send out inspirational books. So we've got a bit of a fund for that. So any woman who would like to review an inspirational book, with Michelle Obama's autobiography or whatever it might be, and we would post that book out to wherever that lady was, and she could read it, pass it on to someone else if she wanted to, and review it. So that was a nice sort of community online project that we were running, and I hope that goes on, actually, remains. And I'll shut up now.
Well, thank you very much for that, Rachel, and thank you very much, both of you, for your presentations and comments. All very interesting and thought-provoking. Rachel, I'm glad to hear that your reserves have seen you through, but a lot of others are not actually in that same position, a lot of the organisations that we've worked with. So can I just ask you both what philanthropists and their professional advisors can do to help charities while they're considering their financial planning and legacies in these difficult times? Andy, perhaps you could go first.
I think it's sometimes a difficult conversation, and it can only be done when the timing's right and perhaps when the client wants to do this. But I think if people can afford to give now, I know some people make provisions for significant legacies, but if they can give now, I don't think we've had a more urgent time. That's one message. And then the other, just going back to the fragility in the sector, particularly around solicitors and wills, having the flexibility in those documents to either review the beneficiaries just in case those organisations no longer exist when those gifts actually come to fruition. Those are my 2 points. Thank you.
Rachel?
Yeah, so I would say please look at broadening restrictions. So normally there's things that they will fund and things that they won't. We're all having to work differently now. Who would have thought we'd find ourselves in this position? For us to be getting out dongles and laptops and things like that. At some point, you would say a cooker is an essential item. I now say access to the internet access to, and a laptop is an essential item for many, many people in poverty. So I think let's like broaden our horizons and of what we can and cannot fund. I also put down just when you're saying there, Andy, about people considering their position, even if they're not ready to give now, have they got some time to give these organisations some real good sound advice, pro bono, to get themselves into a better financial position? Is that something that people can offer at this time? Because we all know these organisations will all run ragged. There's no time to do anything. And we are quite reliant on the goodwill of people. And now's the time, if you're maybe sat at home, but you have some great knowledge about financial stability, maybe now's the time to offer up to Cumbria Foundation that kind of pro bono advice. Is there anything else that I said about? Oh yeah, just very small thing actually. Cheques. I've stood in the NatWest queue for 45 minutes and it started to rain. If there's any way we can move from cheques to backs, that I think that would help a lot of organisations. It's quicker, it's better for us to evidence as well in our end of year accounts and things like that. And that's it really. That's all I've got to say on that.
Well, thank you for that, Rachel. Thank you both. That brings us to the end of our presentation for today. As I mentioned at the beginning, should you have any questions or queries, we're working from home and are always happy to engage with you and your clients. The slide here shows you our contact details and a link to our brochure for professional advisors. The brochure details all of the assistance that we can give to help you and your clients consider a range of options for philanthropic giving during this difficult time and beyond. We look forward to working with you and thank you for your time today.
Bye, folks.